A few years ago, I noticed something strange about myself. My sex drive was not the same as before. At first, I did not think much about it. Work was stressful, life was busy, and most of the times I am tired. But then I realized something. Week passed and still I had no interest in sex. But this was not me. I usually enjoy this intimacy with my partner, and we had this wonderful and healthy relationship. But now I avoided it and make up excuses while I don't want it. This got me thinking, is something wrong somewhere? Why did this happen? Why did my sex drive automatically disappear? And that made me to search for answers. While trying to search for answers, I did what most people would normally do. I went on the internet to search for answers and I saw different articles. Some articles said it was normal, while other articles said it could be as a result of some serious medical condition that needs to be treated. After reading both articles, I got more confused about the whole thing and I picked up my phone to call a friend. I called my friend, I explained practically everything to her, and she advised that I see the doctor. At first, I was skeptical about it. I was scared. I was shy. How am I going to meet the doctor and explain to the doctor about my sex life, my personal life, my private life? But then I summed up the courage, I gathered the courage to visit the doctor. When I finally got to the doctor, she asked me a series of questions. Was I stressed? And my answer was yes. Was I sleeping enough? Not really. Then she asked, was I eating healthy? That's a difficult question. Because of the workload, I eat more of processed food. I hardly had time to make my own meal. Then she asked, have you been bothered recently by anything? Are you anxious about something? Do you feel you are having depression also? And I said, yes, I have been bothered with a lot of things on my table recently. And she also asked me, are you having a problem with your partner? Then I said, because of this whole sex drive thing, me and my partner are no longer in a good term. Then the doctor made me to understand this. She said that when it comes to sex drive is connected to both the mind and the body. Sex drive is connected to both the mind and the body. Lack of sleep, stress, anxiety, depression, and also this time you are in your cycle can affect your libido. And she also made me to understand that changes in my hormone, medications that I take can also affect my sex drive. After this wonderful education from the doctor, I decided to ask her, what advice would you give me to help me bring back my sex drive? So the first advice the doctor gave me was, learn to manage your stress. So because the doctor said learn to manage your stress, I started journaling and I started meditating. The first question I want to ask you in this video is, how do you manage your stress? Generally, I feel stress is inevitable in life, but you as an individual have to learn how to manage your stress. Then the second advice the doctor gave me was, try as much as possible to get enough sleep. With this, I tried as much as possible daily to get at least 7 to 8 hours uninterrupted sleep. Then the third advice the doctor gave me was to exercise. As small as running, as small as jumping, as small as taking a walk went a long way to boost my energy. Especially for those that are working at home, that are not doing vigorous exercise, that are not moving about but just staying in a particular place. It's very important for you to exercise and keep your mind, your soul, and your body active. Then the fourth advice she gave me was eat better. Yes, eat better. So I think it's very important for we to focus on eating vegetables. After my encounter with the doctors, I started eating more of fruits, started eating more of vegetables rather than a lot of processed food, because a lot of processed food, canned food, can have impact on your libido. So eating healthy goes a long way when it comes to your libido. And the other advice the doctor gave me was to talk to my partner. Yes, have an open communication with my partner. Let them know what I am passing through. As little you are having issues with your partner can actually affect your libido. So if you and your partner are always having issues, quarreling, there's always dispute here and there, that can affect your libido and affect your interest for sex. So having an open conversation about sex, about the whole scenario, is going to go a long way to help. After applying the advice I got from my doctor, I started seeing changes. My mood started to improve. My sex drive started improving gradually, but it wasn't getting worse, but rather it was getting better over time. There's something I want you to note, and that is having a fluctuations in libido in your sex drive. It's normal. But if it is lasting for a very long period of time and it is affecting your relationship, making you feel unhappy, it is very important for you to see your doctor. Okay? And I hope you've been able to learn from Sarah's story. Sarah was happy that she went to see the doctor and she was able to get useful help from the doctor. So if all these were not working out for Sarah, if the sex drive still remains same after all this, then we can suspect some other medical condition that can result in low libido. Yes, we're done with the story of Sarah. So if you want to know more about the various causes of low libido in details, we have videos on our YouTube channel that I'm going to attach to this that's going to keep you more informed. All right, and I hope you enjoyed this video and you're able to learn a lot from it. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.